Health and Human Service Reform Committee will come to order. Welcome back, members. Representative Baker moves the minutes from March 20th, 2018. Are there any additions, corrections, or changes to be made? Seeing none, all those in favor of adoption of the minutes signify by saying aye. Aye. Opposed, same sign. The minutes are approved. First up on the agenda today is House File 3824, Representative Torkelson. I will move that House File 3824 be re-referred to the Committee on Health and Human Service Finance. Representative Torkelson, I understand you have the A18 amendment. Representative Torkelson, I will move the A18-0626 amendment. To your amendment, Representative Torkelson.
Thank you, Mr. Chair. This gets the bill in the shape I would like.
Are there any questions on the A18-0626 amendment? Seeing none, all those in favor of adoption of the amendment signify by saying aye. Aye. Opposed, same sign. The amendment is adopted. Representative Torkelson, to your bill as amended.
Thank you, Mr. Chair. House File 3824 is a boring bill, and I have a testifier here who will hopefully not be as boring as the bill.
And members, if we can limit that pun, that would be great today.
Thank you, Mr. Chair, and thank you, members. Thank you for the opportunity to testify in favor of HF 3824. This bill is before you today to solve problems that arose from language in last year's Omnibus Health and Human Services Bill related to borings and environmental wells. We have worked with the Minnesota Department of Health to reach compromise language that addresses our concerns. Geotechnical soil borings are not wells, but were classified that way under the 2017 Omnibus Bill. Soil borings are often used in our field to collect samples to testify for density, plasticity, and moisture content, and also to classify the soils. The bill HF 3824 updates the definition of borings to reflect this. Another problem created by the Omnibus Bill were the additional notification fees, sealing records, and other compliance costs created by the reclassification of soil borings. These have had an impact on the cost of our services to clients, sometimes increasing costs by as much as 15%. These costs are due to the environmental wells language from the Omnibus Bill. None of the changes in HF 3824 would decrease water quality in the state. Engineers are bound by our license to safeguard health and to promote public welfare. So the safety of our water is a responsibility that we as engineering contractors and drillers don't take lightly. These are the major changes that HF 3824 makes to 1031, redefining temporary environmental wells as temporary borings. Notifications and fees only required if borings are deeper than 25 feet. Only one notification is necessary for a property with multiple borings. And as an industry, engineers with the American Council of Engineering Companies strive to uphold the highest water quality standards. We always seal borings where contamination is encountered, regardless of depth, because that is a part of being a responsible engineering contractor. We look forward to doing safe and effective work for Minnesota businesses and governments, and passage of HF 3824 will help us better serve those clients. We stand ready to answer any questions from the committee.
All right, and thank you for your testimony this morning, Mr. Miller. Could you please introduce yourself for the record?
Sorry, my name is Jared Miller.
Thank you, Mr. Miller. Are there any questions for Mr. Miller? Representative Liebling.
Thank you, Mr. Chair. I wasn't going to ask anything, but could you just say, besides your name, like who are you representing?
I am representing the ACEC, American Council of Engineering Companies.
Representative Liebling. Are there any other questions for Mr. Miller? Seeing none, is there anyone else in the audience who wishes to testify on House File 3824? Seeing none, questions for the bill author? Representative Liebling.
Mr. Chair, since this is a topic that most of us don't know that much about, first of all, Mr. Chair, is this bill going anywhere else before it goes to the floor?
The motion, Representative Liebling, is to go to Health and Human Service Finance.
And I wonder if somebody from the Department of Health is here that could just speak to this before it goes on.
Certainly. Welcome to the committee. Please state your name for the record and fill us in a little bit.
Sure. Thank you, Mr. Chair. I'm Chris Elverum. I manage the well program at the Minnesota Department of Health. And yes, this is the result of a bill that was passed last year that was attempting to streamline the number of wells and borings that we regulate. And I think we, as the previous testifier mentioned, we sort of missed the boat, or we missed the understanding what would get wrapped up into it. So there's geotechnical borings, which are still a potential threat to groundwater and to drinking water. So we want to make sure those are, in fact, sealed up properly. But we are confident that with this bill, even though it'll exempt the fee and notification, the sealing requirement will still be there. And so they'll have to seal those up according to the rules that the Commissioner of Health promulgates. And so I think it's a good compromise to recognize that some of these borings, these are along roadways or for foundations. They don't really need the oversight of the other types of borings that are going to be more permanent. They're going to be deeper, and so we feel that this is probably something that works fine with us. It will still ensure that they're sealed up, protecting groundwater, drinking water, but it won't be an unnecessary regulation of these that they do all the time along these kind of low threat, low risk areas.
All right, thank you. And what was your name again for the?
It's Chris Elvrum.
Elvrum. Okay, thank you. Representative Liebling.
Thank you, Mr. Chair. Thanks for coming down to give us that information. So before this was changed in the last omnibus bill, is this kind of the way it was before?
Yes, Mr.
Sure.
Chair and committee members, there was there was something called environmental borehole that we grouped together with these environmental wells, and that had the same 25-foot limitation. And since we put them together, we didn't want to have 25 feet be the minimum for regulating permanent monitoring wells, so we moved that to 15. And so what it did then is also took these temporary borings, which are just soil borings, and moved them to 15 feet. So yes, there was already a 25-foot provision in the previous law.
All right. Thank you, Mr. Chair.
Thank you, Representative Liebling. Are there any other questions for the department? Seeing none, the committee thanks you for your testimony this morning.
Thank you.
Are there any other questions for the bill author? Final word, Representative Torkelson.
Well, thank you for hearing this bill.
With that, I will renew my motion that House File 3824 as amended be re-referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign.
Aye.
The motion prevails, and House File 3824 as amended is re-referred to the Committee on Health and Human Service Finance. Next up, House File 3856, Swedzinski. I move that House File 3856 be re-referred to the Committee on Health and Human Service Finance. Representative Swedzinski, you have an A2 amendment. I will move the A2 amendment.
I believe it's an A1, Mr. Chair. Is it A2? A2.
It's
sorry.
A2,
Yep,
Representative. To your amendment, Representative Swedzinski.
Thank you, Mr. Chair. This amendment gets the bill in the shape that we'd like it under and with the department's liking.
All right, are there any questions on the A2 amendment? Seeing none, all those in favor of adoption of the A2 amendment signify by saying aye. Aye. Opposed, same sign. The amendment is adopted. Representative Swedzinski, to your bill as amended.
Thank you, Mr. Chair. This bill provides that a single well notification fee of $275 instead of $275 per boring it does apply to all environmental orders marked on the boring map and submitted to the Commissioner of Health and Commissioner of Natural Resources. This was something that came through last year and is having an effect on businesses throughout the state. I do have a testifier here to speak on that effect, and we appreciate your support to this. So thank you.
All right, welcome to the committee. Please state your name for the record and present your testimony.
Mr. Chairman, members of the committee, my name is Frank Ungaro. I'm Executive Director of Mining Minnesota. We represent all the non-ferrous industry companies in the state of Minnesota, exploring, doing mineral development projects, and proposing copper-nickel projects in the state of Minnesota. Decades before any mining operation gets to the point of proposing a project, companies are out spending tens of thousands, if not tens of millions of dollars, poking holes in the ground, defining their mineral deposit to see what assets they have, and investing in the state of Minnesota. We have state, private, federal minerals, state, private, federal lands surfaced in the state of Minnesota and every combination thereof. And every company that proposes a hole must file with the Department of Health what their intent is on their plan of operation. We've had a tremendous working relationship with the Department of Health over the years. Last year, when a variety of new health fees went into place, a brand new one on exploratory borings was put in place as well. And we certainly want to continue inviting that investment into the state, and we're not opposed to a fee, but the way it was structured with every hole, thousands of potential holes being drilled over the course of some years, that seemed a bit excessive. Working with the Department of Health, I think we have, I'm not going to certainly speak for the Department of Health, they can themselves, but I believe we have an understanding that this is an acceptable approach to have one fee for each plan that's proposed. Nothing changes as far as the policies that are in place to identify, monitor, temporarily cap, permanently abandon, and protect groundwater for all exploratory activities. This just provides some reasonableness and certainty for all the companies as they go forward. Thank you, Mr. Chairman.
All right, thank you, Mr. Anderon. Are there any questions for the testifier? Seeing none, the committee thanks you for your testimony this morning. Is there anyone else who wishes to testify on House File 3856? Seeing none, are there any questions from members for the bill author? Representative Liebling.
Mr. Chair, once again, could we get the gentleman from the Department of Health to come and comment? Sorry if you thought you're going to get away with it this morning.
I guess I need an
We got
invite
you.
to show up here.
Welcome back. If you could please reintroduce yourself for the committee
Thank you,
and present your testimony.
Thank you, Mr. Chair and committee members. Chris Elverum, manager of the well program at the Minnesota Department of Health. And similar to what we heard in the last bill, these are holes in the ground that do potentially add a risk to groundwater and drinking water sources. And as the testifier pointed out, these are already required to be regulated. They're required to be constructed in a manner that's in accordance with the rules and laws, and sealed up when they're done, so they do protect groundwater. There was no fee on these, and they're often in remote areas, and it takes a lot for our inspectors to get out there. We don't inspect 100% of them, but when they do, it's some effort. So a fee seemed reasonable. And what was passed last year was a fee per boring. And we, in some cases, have site fees for other things like environmental wells, where if you're doing 6 on a property, you pay 1 fee because we're not going to go there 6 times. And so this is a similar situation. It's not quite as simple as having a property up in the North Woods, but we came to some compromise. I think that is very workable with this map that's already required to be submitted. And so there might be 5 or 6 borings on a map, and they'd pay 1 fee. The other side of it is that drinking water wells, there's 1 fee per well. And so, that could be the argument for the other side. If you're drilling 6 drinking water wells, you'd have to pay us 6 fees. But we think the site fee is reasonable, considering that we probably will go to each project once for inspection.
Representative Liebling.
Okay, thank you.
Are there any other questions for the department? Seeing none, the committee thanks you for your testimony this morning. Any other questions for the bill author? Seeing none, final word, Representative Swedzinski.
Thank you, Mr. Chair.
With that, I will renew my motion that House File 3856, as amended, be re-referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails. House File 3856 is re-referred to the Committee on Health and Human Service Finance. Thank you, Representative Swedzinski. Next up, and we're going to go a little bit out of order here to for the authors that we have, House File 3640, Representative Albright. Representative Albright moves that House File 3640 be re-referred to the Committee on Civil Law and Data Practices Policy. Representative Albright, when you're ready.
Thank you, Mr. Chair. The bill provides provisions governing background checks conducted by health-related licensing boards. Procedures related to temporary suspension for actions present an imminent risk of serious harm. I have 2 testifiers with me today. They are both recognizable to you. They will represent the bill to you, and I urge your support. Thank you.
Thank you, Representative Albright. Welcome to the committee. Please state your name for the record and present your testimony.
Thank you, Mr. Chair. Members of the committee, my name is Ruth Martinez. I'm the Executive Director of the Board of Medical Practice, here representing the 16 health licensing boards. This bill, House File 3640, does several modifications to Chapter 214 of Minnesota statutes that affect all of the processes, or several of the processes of the health licensing boards. We're specifically making modifications to 214.075 under criminal background check section. You may recall that the criminal background checks were implemented over a series of years with all of the licensing boards. All have now implemented as of January 1st. So I'll just take a walk through. We're eliminating some of the implementation language since it's no longer necessary and all of the boards have implemented. We are clarifying the validity of a criminal background check as being valid for 1 year from the date the report is received by a board. We are creating an exemption from criminal background checks for individuals applying for additional licenses from the same board within that 1 year. And for example, a nurse coming in from another state would have to apply for an RN license in Minnesota before she could apply for an APRN license, and that may happen within 24 to 48 hours. So this exempts that individual from having to repeat a criminal background check for that next license with the same board. It's not a multiple use of the CBC, just an exemption. It also creates authority, specific authority for criminal background checks for current licensees seeking eligibility to participate in an interstate licensure compact. You may recall that we ran into some issues with the FBI on the medical licensure compact, having concerns about whether we had clear authority for that criminal background check for current licensees, and I'll get to another modification in a moment related to the compact. This also removes a 90-day time period related to refusing to consent or submit fingerprints. If they don't submit fingerprints, they can't get a license. So we just realized that this was an unnecessary section of the chapter. We are also modifying some of the language just to clarify and have consistency in how we reference national criminal history records checks. We are authorizing an alternative method of criminal background check after an applicant has submitted 2 rather than 3 sets of unreadable fingerprints. The BCA actually has kind of a 2-for-1, so after they will do the second set of fingerprints for the same cost, but if you do the third set of fingerprints, they charge another fee. So this just doesn't require that second fee. So after the second set, we'll go to another alternate form of criminal background check. Under Chapter 214.10 in the data sharing section of statute, we're doing some additional language to prohibit the exchange of criminal history record information. This is again related to the FBI's concerns about the medical licensure compact and some concern that we might be sharing that data either across state lines or with the interstate commission that oversees the compact. We're also doing some modification of the language under our section related to temporary suspension of licenses. We, for those of you who are familiar with the process, when we temporarily suspend a license, we move into an administrative hearing process very quickly. And we had kind of a 30-day, 30-day, 30-day timeline in place. So we'd temporarily suspend a license. Within 30 days, we have to initiate that administrative hearing process. Within 30 days of completion of that hearing, the judge files a report back to the board, and within 30 days of receipt of that report, the board has to move to final action on the license. Most boards meet every 60 days, and so we came to realize that we were having to convene a quorum of a board possibly just after or just before a regularly scheduled board meeting, and we ran into some real challenges with convening a quorum. So this language that we are adding, if the report from the judge comes back recommending dismissal, or no action, I should say, we would still convene within 30 days. If the report recommends discipline, then the board would have up to 60 days to move to that final action. Shirley Brecken here. I'm going to talk about 364. We have a second testifier who will talk to one of the other changes.
Mr. Chair, Ms. Brecken would like to make some comments.
Welcome to the committee. Please state your name for the record and present your testimony.
Thank you, Mr. Chair. My name is Shirley Brecken, and I'm the Executive Director of the Board of Nursing. This bill also would exempt the health-related licensing boards from Chapter 364. The intent is, right now, the BCA in 364 can only disseminate convictions. So when they get the report back from the FBI before they pass it on to the boards, they must redact all of the arrests and charges. That has added time. Actually, it takes about 3 to 4 weeks for us to get a report once it comes back from the FBI and then through the BCI redacting process before it gets to us. So it really delays individuals being able to go to work. Additionally, the board may, if we're not aware of the charges or arrests, may license an individual, find out about, once the court has brought it to final disposition, find out the individual indeed was convicted of those charges, and then we have to go back and deal with the license at that time. So this would make the boards of all of the health-related licensing boards the same as the Board of Teaching, the Post Board, taxi cab drivers, school bus drivers who are exempt from that Criminal Rehab Act. We still would deal with the conduct and can deal with the conduct through our own practice acts, which allows us to look at the nexus to the practice and then make a decision regarding discipline of the license.
Thank you, Ms. Brecken, for your testimony. Are there any questions for these two testifiers? Representative Liebling.
Thank you, Mr. Chair, and not really a question, but just for people to know that I'm a co-author on the bill, and I worked with the two testifiers, and I'm comfortable with it, so thanks.
Thank you, Representative Liebling. Are there any other questions for the testifiers? Seeing none, the committee thanks you for your testimony this morning. Is there anyone else who wishes to testify in House File 3640? Seeing none, are there any final questions from members for the bill author? Seeing none, final word, Representative Albright.
It's a good day.
With that, Representative Albright renews his motion that House File 3640 be re-referred to the Committee on Civil Law and Data Practices Policy. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 3640 is re-referred to the Committee on Civil Law and Data Practices Policy. Next, Representative Theis, House File 3451. Representative Theis moves that House File 3451 be re-referred to the Committee on Health and Human Service Finance. Representative Theis, we have the bill in front of us. To your bill.
Thank you, Mr. Chair and members. Basically, this bill allows an exception to transfer 66 clients from Whittier Place in Minneapolis to 3 locations in Hennepin County, and with that, I'm going to turn it over to my testifier.
Welcome to the committee. If you could please state your name for the record and present your testimony.
All right. Good morning, Mr. Chair, committee members. My name is Joe Cuoco. I am with Supportive Living Solutions. I am here in regards to our Whittier Place location. Supportive Living Solutions in general provides housing with services to clients with severe and persistent mental illness. The majority of our locations are apartment-based, where they have their own apartment. The exception to that is Whittier Place, where it's the old school style of being a group home, where you have maybe 2 or 3 people sharing a room. What this bill would allow us to do is move our clients from this location up to 3 separate locations and afford them more independence, more privacy, and more of a person-centered care approach. So we have talked with DHS about this. They have provided technical support with the language. We do not foresee any cost in this, as we're not increasing our beds, and so we are just asking for your support in this move. So with that, I'll open up for questions.
Are there any questions for Mr. Coloco? Representative Sandstead.
Thank you, Mr. Chair. Good morning. Just out of curiosity, how did the clients feel about this? If they're, living in a place where they have roommates or friends that they might be accustomed to, and now they're going to be moved somewhere else?
Mr. Chair, we're not going to force them to move, so it will be an option for them. We have talked with them a lot, and so the majority of them actually want to move, but it's not going to be anything that we would ever force upon them. It will be better regardless that they have their own apartment or a shared apartment, one kitchen, which they don't have right now. They just do congregate dining. So overall, I would be surprised if there was a large majority of them that would not want to move. But if they don't, then they have the choice of staying where they're at. We're not going to force them out of their home.
Thank you.
Thank you. Are there any other questions for Mr. Kuloko? Representative Liebling.
Thank you, Mr. Chair, and maybe this would be more for the department, but, so the bill says the Commissioner of Human Services shall allow, and I'm just a little curious about why we're passing a bill that essentially tells the department to grant permission. Is this something where the department normally would have discretion and has said no, or what exactly? Sorry if I missed that initially. We were here very late last night. So I may not be completely getting everything that's said today, but maybe you could just explain that. Why are we mandating in this bill that the department allow this?
So, Mr. Kuloko.
So the way that it's working right now, the DHS has internal policies, and there's the state statute as well that would prohibit us from doing this. There's language that basically grandfathers Whittier Place to allow them to have the 66 beds without any restriction. If we move, and according, again, speaking with DHS, if we move our beds out of the Whittier location, we lose that grandfathering. And so that's where this language comes in, saying that these beds would be allowed, so basically grandfathered into these locations.
Representative Liebling.
Okay, thank you, Mr. Chair, and I hope that the department will also come down and testify on this.
Welcome to the committee. If you could please state your name for the record and present your testimony.
Mr. Chair, members of the committee, Representative Liebling, it's actually a limit in our waiver plan that we're not able to allow the setting to move, and so this bill would allow us to grant the authority to take the same people and have them move to a new setting.
And Ms. Hamilton, could you please state your name for the record?
I apologize. My name is Heidi Hamilton with the Department of Human Services.
Thank you. Representative Liebling.
Thank you, Mr. Chair. And so, Ms. Hamilton, that sounds perfectly reasonable, but I don't know then why it says the Commissioner of Human Services shall allow, should say may allow, right? Because you want to do it, you would do it. I just think it seems a little unusual to me that we put in statute that you must. Is that common? Am I just?
Ms. Hamilton.
Mr. Chair, Representative Liebling, this type of exception is not common. I think it would, it'd be okay with the department if it said may, because then we could assure that the setting met the home and community-based setting requirements. But I don't want to speak for the stakeholder behind the bill, if they would rather have it say shall. But may would be good with us.
Mr. Chair?
Representative Theis.
I just want to make the comment that DHS did work with Joe in making sure that the language was the way they wanted it. So why shall was chosen, I don't know, but that was the language that was given.
Thank you, Representative Theis. Representative Liebling.
Well, thank you, Mr. Chair. I guess I don't need to make a big deal out of something that nobody seems to really care that much about. But it does seem a little odd to me that we would pass a statute, mandating this when it does take away the flexibility. Presumably, if this passes into law, that's it. And no matter what other thing might pop up, it's a shall.
Ms. Hamilton.
Mr. Chair, Representative Liebling, the setting has met the assessment criteria for the home and community-based settings, and so we know that Whittier Place meets the requirements, and so we will work with Mr. Cuoco and his organization to make sure that the new settings also meet the requirements.
Representative Liebling.
Okay, thanks, Mr. Chair.
Are there any other questions for the department while we have them down? Representative Sandstead.
Thank you, Mr. Chair, and I apologize too if you maybe stated something like this earlier. I am tired. With moving clients out of this facility into another independent kind of living setting, is there any chance that Whittier Place itself would be looking at closing down because of either the type of setting that it is or losing clientele?
Mr. Kuoliko.
Mr. Chair, so we would not, well, maybe I should ask to get clarification on the question. Are you asking us if we don't move this, will we close down? Or are you saying that once they are moved out, then Whittier will close down?
Mr. Chair?
Representative Sandstead.
Thank you. I am asking, is there a possibility of them closing should these clients move due to either numbers or relocating them to other facilities? Is there another intended use for this facility?
Mr. Kuoliko.
Mr. Chair, at this point, there's not another intended use, but that is something that we would be looking into if this passes, as to working with Hennepin County in regards to maybe some other services that is needed at this time that space could be utilized for. We don't intend to just give it up or just let it sit there doing nothing. So if all of the clients ended up moving out, then we would probably repurpose it for some other service within the human services field.
Representative Sandstead.
Thank you, Mr. Chair. In the spirit of transparency, is there something in the works? I just know that we have a shortage already of services and lack of beds, a lack of placement for so many Minnesotans. I'm just curious if this is going to create more of a shortage, maybe even unintended.
Mr. Chair, I don't believe, I mean, if anything, it would add. I mean, if we moved our clients to other locations, so the beds would remain the same level, the numerical number, and if we ended up doing something at Whittier location, it would actually increase, bed space, I guess. But we have talked with Hennepin County in regards to possibilities, and IRTs or something along those lines, a treatment center. We don't know. I can openly being honest with you, we do not have a set plan for Whittier Place if it ends up not having any clients at this point in time. Our hearts and soul are about the community and serving the people that are in need, the disabilities, especially people with disabilities. So if something, if Whittier Place ended up without any clients there, that is the direction, that is what our company is about, and that's the direction that we would go.
Representative Sandstead.
Thank you.
Are there any other questions for the testifier? Seeing none, is there anyone else in the audience who wishes to testify in House File 3451? Seeing none, member questions for the bill author? Final word, Representative Theis.
Thank you.
With that, Representative Theis renews her motion that House File 3451 be referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 3451 is re-referred to the Committee on Health and Human Service Finance. Thank you, Representative Theis.
Thank you.
Next, House File 3253, Representative Franson. Representative Franson moves that House File 3253 be re-referred to the General Register. Representative Franson, the bill is in front of us whenever you're ready.
All right, thank you.
Thank you.
All right, good morning, everybody. What a great day to be here. I feel like I just left this building.
All right, in front of us, we have House File 3253, the Positive Supports Rule. We've heard this for the last few years. Here we are again. This bill exempts child care providers from the, oh gosh. Anyway, it's been a lot. I'm retired. Positive Supports Rule. It instructs providers to comply with the child's individualized IEP, if there is one, for a child with developmental disabilities or a related condition in their care. And the bill also states that staff at child care home or facility are, however, still not allowed to use the procedures listed as prohibited under this chapter. No restraints, seclusion, etc. The 8 to 14 hours of additional training is time-consuming and not needed. And that concludes my introduction remarks, Mr. Chair.
All right, thank you, Representative Franson. And we'll open it up to testimony then.
We're just going to take questions if there's questions.
All right, we can do that. Welcome to the committee. If you could please state your name for the record and present your testimony.
Thank you, Mr. Chair and members. My name is Claire Sanford, and I am with the Minnesota Child Care Association.
Okay. Are there any questions for the testifier? Seeing none. Is there anyone else who wishes to testify in House File 3253? Seeing none, are there any final questions from members? Representative Liebling.
Thanks, Mr. Chair. I know this was heard in the Child Care Committee, but I don't know if a lot of members of this committee are that familiar with it. I wonder if the department will come down and comment on this.
Welcome to the committee. If you could please state your name for the record and present your testimony.
Mr. Chair and members, my name is Christopher Orr. I'm the Legislative Director for Operations for the Department of Human Services. As Representative Franson expressed, I know we've had discussion on this topic in previous sessions, and I think as we've expressed in previous sessions, the department would have concerns with any blanket exemption for child care licensed providers from the positive support rule, as there are concerns that it would put us out of compliance with the Jensen settlement.
Representative Liebling.
I think that pretty much says it all. Thank you, Mr. Chair.
Are there any other questions for the testifier? Seeing none, the committee thanks you for your testimony this morning. Are there any other questions from members for the bill author? Seeing none, final word, Representative Franson.
No, that's fine. Thank you, Mr. Chair.
With that, Representative Franson renews her motion that House File 3253 be re-referred to the General Register. All those in favor signify by saying aye.
Aye.
Opposed, same sign.
No.
The motion prevails and House File 3253 is re-referred to the General Register. Next, we have House File 3198. Haley. I will move that House File 3198 be re-referred to the Committee on State Government Finance. Representative Haley, welcome to the committee. We have the bill in front of us, and you have an A2 amendment.
Good morning, Mr. Chair and members. Can we move the A2 amendment first?
I will move the A2 amendment. Representative Haley, to your amendment.
The amendment just clarifies that we want the Commissioner of Health involved in the study. I've been partnering with all the stakeholders, and so I would like that added, if the committee agrees.
Are there any questions on the A2 amendment? Seeing none, all those in favor of adoption of the A2 amendment signify by saying aye.
Aye.
Opposed, same sign. The amendment is adopted. Representative Haley, to your bill as amended.
Thank you, Mr. Chair and members. Good morning. Thank you for allowing me to testify on 3198. You're all aware that health insurance rates are impacting the business growth, sustainability in my region, which is Goodhue and Wabasha County. And not only is this impacting my area, but really all of rural Minnesota. And my bill seeks to address that by requesting a study by the Office of the Legislative Auditor. I'll point out briefly what the study will do. First, identify the factors that are causing the higher insurance rates in certain geographic rating areas and the extent to which these factors contribute to the higher rates. We want to identify the impact on referral centers in southeastern Minnesota and the ways that we can reduce the disparity between southeastern Minnesota and the metro. Third, we want to look at the effect on both individuals and small employers in these high-cost geographic areas. And lastly, we're asking the OLA to develop at least 3 proposals for redrawing the geographic rating areas and giving the legislature some recommendations that we can pursue next session. I'm certainly aware, as all of you are, that a study doesn't solve all the problems and that this is a very complex issue. But I would like the legislature to be better prepared next session to address this. I've been working diligently with all the players involved, the insurance providers, the OLA, the Department of Health, Mayo, and our state economists. My bill is not intended to poke any one of these stakeholders in the eye. That's not how I work. I seek to partner with all of the stakeholders to understand the dynamics of the insurance market and to impact some change. The purpose of gathering the data is not to be punitive. What I seek is a common understanding based on actuarial facts so that we can analyze and propose some solutions. I'd like you to remember that I do not want the data to be a hammer, but instead a flashlight to illuminate some new models that we can use going forward. My district and most of rural Minnesota cannot survive much longer with our current health insurance model. I'll give you just a few examples. I had a farmer in my office yesterday. He had a new baby, something most of us would be thrilled about. But his first comment to me is that his bill out of his pocket for the new baby is over $12,000. That money was to go to seed. That's a significant impact for an individual farmer. And then I have businesses in my area. Cannon Falls sits on the border between Goodhue County and Dakota County. And if you're a business in Cannon Falls, if you could move your business 5 miles over, you would save 40 to 60% on your health insurance costs. That's 40 to 60% additional monies that come out of paying your employees' wages, that come out of your profit that you can reinvest in your business. There's a new housing development in Cannon Falls that sits close to Randolph. And I've had residents tell me that they're trying to sell their house that sits in the Cannon Falls area, Goodhue County, and move to the housing development that sits in Dakota County because they could pay their new mortgage with the brand new house and the new development with the money that they would save in health insurance. I'll give you an example of some of those rates. Comparing Goodhue County with Dakota County. Monthly premium for a family of 4, 45-year-old father, 38-year-old mother, children's 10 and 12. Monthly premium in Goodhue County, $2,077 with a deductible of $13,300. Monthly premium in Dakota County, $1,600 and a deductible of $10,000. I could have filled this room today with testimony from people from my district and all over outstate Minnesota, but I know you're short on time, so I'll leave you with those statistics, and I would appreciate your support to move this bill forward.
Thank you, Representative Haley. Are there any testifiers for House File 3198? Seeing none, we'll move to member questions. Questions for the bill author. Representative Liebling.
Thank you, Mr. Chair. And Representative Haley, thank you for working on this issue. I'm totally with you on the problem. I've been working on this. I've carried bills to try to fix this problem because I'm from the same rating area that you are, and the way you state the problem is absolutely correct. The only concern I have about this, I think it's actually a great idea to have the OLA study this. That often is a way to move something forward. My concern, though, is that I'm also on the Legislative Audit Commission. Mm-hmm. And the way, I know that in recent years it's become more and more common to write bills to direct the OLA to study this or that or to do this or that. But we actually have a process in place for getting the OLA to do a study. And the process is one that, you know, the OLA, as you know, has limited resources. We ask them to do a lot, and it seems like the scope of what we ask them to do keeps growing. And the process that we have in place, actually right now, I think that members have in their mailboxes something, we're in the topic selection process right now. And the beauty of that topic selection process and the way this is done through the normal process is that it allows members to suggest topics, And the topic selection committee, Representative Quam is on that, on the subcommittee. Topic selection, they just narrowed the selections from things that members submitted, and then we have a process where members all vote on that. So it's a process that really allows all of the legislature, House and Senate, to kind of come together to direct the OLA on how we want them to study things. So, this is not the first time somebody's
Yeah, I know.
tried to do this or done it this way. So it's not that out of the realm. But I just want to ask you, did you try to go through the other process? What was your discussion with the Office of the Legislative Auditor about going this route as opposed to the other route? I mean, did you, I'm not on the topic selection committee, but did you suggest this as a topic? Because I would sure like to get together with you to push the topic forward.
Representative Haley.
Mr. Chair, and thank you for the question, Representative Liebling. Yes, I did. I met with the Office of the Legislative Auditor, Mr. Nobles, and his staff before I enter in the process of drafting the bill, and I pursued a two-prong approach. I did submit this in my request as one of the things that should be studied and talk to various members. I didn't want to risk that it not make the list, so I wanted to pursue it in the bill format as well. And in fact, we do have our choices, and it wasn't on one of the choices, so I will diligently pursue this route. I realize that it will cost some money for this to take place, and hopefully this bill gets referred to Finance, and we're identifying some dollars there. But I do have the support of the Office of the Legislative Auditor to do this work, in addition to the help with Department and Commerce.
Representative Liebling.
Okay. Well, thank you, Mr. Chair. Thanks for that information.
Thank you, Representative Liebling. Representative McDonald.
Thank you, Mr. Chairman. Great minds think alike. So, Representative Liebling, that was my same question. So it is answered. Thank you.
Thank you, Representative McDonald. Representative Freiberg.
Thank you, Mr. Chair. I mean, I was going to ask something along those lines. However, just looking at the language, I mean, it doesn't actually require as I read it, it doesn't even require the legislative auditor to conduct this study. On line 1.9, it says the legislative auditor is requested to study disparities in insurance, among geographic rating areas. Line 1.13, it reiterates this. It says in the study, if conducted, the legislative auditor shall. So, I mean, it doesn't actually require this study to happen. And I mean, we've sort of been seeing lots of these bills, creating task forces, advisory councils, working groups, and now OLA studies that don't necessarily need to happen. I mean, it sounds like this is a serious issue and, that should require some sort of meaningful action. And I guess I'm just, seeing lots of serious issues and lots of studies. I mean, it's always good to have lots of information, but I think you can kind of get into study paralysis at a certain point. So I don't know. If you want to comment on that, sure, but otherwise it's just a
Mr. Chair,
comment.
may I?
Representative Haley.
Thank you for the comment, Representative. The reason I used that language again in meeting with the OLA, at the time I drafted the bill, I hadn't figured out how we could fund it yet. So again, in the spirit of partnership, I had that permissive language, and my commitment to them was that I would figure out where we could get the funds. So again, in Finance, we'll have that discussion on funding, but I think I've secured that. So that's why the language was written that way. I do have their commitment to do this work. Another point we should all recognize is part of this is we're still under the constraints of the ACA and having to have certain geographic rating areas. We would have to apply for a federal waiver. That takes at least a year unless we were able to fast track it through our congressional delegation. And in that application, you have to have significant data. So doing this study would also put us in position to apply for a waiver and have that information ready to go,
Thank
if
you,
that's helpful.
Haley. Are there any other questions for the bill author? Representative Olson.
Thank you, Mr. Chair. And I know we're not here to discuss finance, but I am curious, would you be willing to just share about that funding source that you have in mind? That'd just be helpful to know within the context of how this may move. Thank you.
Representative Haley.
I'm actually not going to comment on that because I'm not 100% and I don't want to, but I will by the time we have the Finance Committee. I can talk to you offline if that's okay, what we're looking at.
Okay, thank you.
Any other questions for Representative Haley? Final word, Representative Haley.
I'd appreciate your support. Thank you, Mr. Chair.
With that, I'll renew my motion that House File 3198 as amended be re-referred to the Committee on State Government Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 3198 is re-referred as amended to the Committee on State Government Finance. Thank you, Representative Haley. Next is House File 3403, Representative Peterson. Representative Peterson moves that House File 3403 be re-referred to the General Register. Representative Peterson, this is a committee engrossment, and so Representative Peterson moves the committee engrossment. Representative Peterson to the committee engrossment.
Thank you, Mr. Chair and members. As you may know, that we had a subcommittee on child care access and affordability chaired by Representative Franson and Minority Lead Representative Flanagan, and we heard a lot of testimony from a lot of providers, and this bill is a result of that work. We are all aware of the child care shortage that is impacting communities and families in all areas of the state. Part of the solution to this shortage, often described as a crisis, is regulatory reform. This is something that was discussed at length, and I believe it is time to take action. In my time working on this complex issue, I've learned that there isn't one simple solution. It's going to take a lot of work to make progress. But there is interest, passion, and engagement by stakeholders and members of this body, and I'm confident we can work our way through this. With this bill, I'm bringing forward a two-pronged approach. First, we need to give some immediate regulatory relief to child care providers in a way that still protects the safety of children in care. Next, to truly move forward, we need to work together on a wholesale reform of child care licensing. Things are simply not working as they should, and if we do not address the root cause, a decades-old child care rule, we will continue to be stuck. Along with overbearing regulation, poor communication between DHS, counties, and providers, and a punitive versus supportive role of government, this has created businesses to leave and close their doors, and thus creating the shortage. So in the committee engrossment, these are some of the ideas that came forward in the subcommittee and with input with stakeholders along the way. And they reflect a start at addressing regulatory issues that are impacting child care providers. In Section 1, it updates the safe sleep system language. Section 2 eliminates the redundant insurance disclosure. Section 3 requires the DHS to explain when their determination is different than the county. And in addition, we also have an A3 amendment, which includes some additional items identified through the past few weeks, and it also instructs the department to take the first steps to plan for new rulemaking. Specifically, Section 1 clarifies that the staff qualification variance is available. It is my hope with better communication and clarity around variances like these could help ease some staffing issues that are impacting child care availability. Section 2 clarifies in statute that a variance is available for licensed family care providers with a Class D license wishing to flex their staffing. The variance allowed the provider to staff only on the days the infant was in care, for example. Both Sections 1 and 2 have been okayed by the department, and it's my hope that clarifying the availability of this variance will help create more options for infant care. Section 3 directs the department to undertake a planning process that will ultimately result in the rewriting of Minnesota's child care rules. As I mentioned earlier, our current rules are decades old and are the cause of much of the regulatory pain being felt by providers. To get this best result, some prep work should be done before undertaking the full rulemaking process. And so this language directs the department to review available research, best practices, and other information about child care licensing systems around the nation and how child care systems can be aligned with other provider supports. It also directs the department to review relevant administrative data that can inform inform the reform effort. Finally, it directs the department to undertake a stakeholder engagement process to share the findings of the previous steps in this process and to learn from providers, counties, nonprofits, parents, and other stakeholders about their views. and potential directions on regulatory reform. I envision this engagement process to be a first step at rebuilding a relationship between the department and the child care provider community. It would be my wish that this process involved an independent third party, such as the Bureau of Mediation, for example, in the process of stakeholder engagement and provide opportunities that feedback to be gathered from both in person and online to gather from a broad group of stakeholders in a way that is convenient to them. And I do have some testifiers here as well, Mr. Chair.
All right, thank you, Representative Peterson. It's my understanding that we have to adopt the committee engrossment and then adopt the A3 amendment to get the bill in which you would like to discuss for the rest of the day. Are there any questions on the committee engrossment? Seeing none, all those in favor of adoption of the committee engrossment signify by saying aye.
Aye.
Aye. Opposed, same sign. The committee engrossment is adopted. Representative Peterson moves the A3 amendment. Are there any questions on the A3 amendment? Seeing none, all those in favor of the A3 amendment signify by saying aye. 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 Opposed, same sign. The A3 amendment is adopted. Representative Peterson, 2-year bill.
Well, I basically have gone through that, and I think we'll move on to testifiers at this time.
All right, welcome to the committee. Please state your name for the record and present your testimony.
Thank you, Mr. Chair. My name is Cisa Keller. I'm the Senior Vice President of Early Childhood Quality Development at Think Small. Think Small is a nonprofit organization dedicated to ensuring that every child in Minnesota has access to quality early childhood care and education in their crucial early years. And so I'm here today in support of the provision specifically in the A3 amendments, and want to start by thanking both Representative Peterson as well as the members of the Subcommittee on Child Care Access and Affordability, and taking the time to really look at this very important issue of the need to ensure that every child has access to high-quality child care throughout the state of Minnesota. Specifically to the A3 amendment, we feel like this is a really significant move forward in first, as Representative Peterson says, providing some immediate regulatory relief to providers as they're trying to serve the children and families in their community. And we do this in a way that keeps the health of children, the safety of children focused at the center of this, while still ensuring that providers are able to do the best work that they can do. And then on this second part around creating a process in which we are actually creating a comprehensive process that incorporates current research, best practices broadly looking at various issues, as well as a very inclusive stakeholder engagement process to really come up with a plan on how do we look at these rules that regulate child care. And at that, I will just say that we are supportive of this A3 amendment and look forward to this committee moving it forward.
Thank you, Ms. Keller. Are there any questions for the testifier? Seeing none, the committee thanks you for your testimony. Representative Peterson, do you have any other testifiers?
Looks like we have someone coming up.
All right, welcome to the committee. Please state your name for the record and present your testimony.
Cindy Cunningham. I'm a family child care provider in St. Paul. I am also a representative for the new state association, McPinn, which with MLFCCA being disbanded, we are one of the associations that came into place. I juggle toddlers, infants, and preschoolers all day. Legislative session this year has been quite complicated to keep up with on wording, so I will try to make my points clear to the points as they're presented. McPinn has a public policy agenda that included trying to get input by stakeholders into the potential regulation changes. I like visuals. Just for an example, this is the rule book from about 10 years ago. It was only 9502 type that you could read. This is the current book that includes 245A, and I teach a class on Rule 2, and it's a very difficult class to teach to make sure people can track it and follow it. It's too complicated. So I am 100% in doing this with legislative involvement and stakeholder input. And thank you, Representative Peterson, again, for bringing these issues forward. My comments on the, on the ratios is in support for that from McPinn. And as far as the direction to commissioners, I We support, obviously, the need to have stakeholder input and move forward. There were other discussions and bills about having that be in place. My concern in a short comment is connecting best practice and a quality rating program to rulemaking is concerning to me. Often best practice and quality rating is, as much as it needs to be evaluated and checked within other states and brought forward and our top of the barrel standards for rulemaking for safety and health practices. There are many providers in such situations and settings that best practice is not where we can stand on an across-board rulemaking. I would also suggest that as family child care providers, the statistics are that family child care providers are not as involved with the quality rating system, primarily because there is not a business benefit to us, not because we don't want quality. We often have quality. As a small business, for the investment that I put into going through a rating system, which I have a couple times, there has to be a payback for me at some point in time. As the system is set up for family child care, there really is not one. And I have been denied a step up in my rating because I didn't have a date put in correctly. I do not consider that quality. So an overall view of the quality rating system, and in particular on those kinds of practices and things that would actually make it a quality rating, I 100% support. Tying it to licensing, I think there will be a hurdle to go over for family child care and potentially for centers to enter into that discussion when it is directly connected to licensing and rulemaking. I see the connection. We want it. We want the quality. It isn't necessarily where rulemaking should be.
Thank you, Ms. Cunningham. Are there any questions for the testifier, Representative Sandsted?
Thank you, Mr. Chair. Good morning, and thank you so much for your testimony. I had the opportunity this past weekend to meet with several child care providers in my community. And in regards to your rule book, if you can hold that up again, I just want to share something with members. This comes out on an annual basis, and it is not provided to providers. They have to actually go online and purchase that at a cost to themselves. And every year that there's an update, every year that something happens, changes that are made in regulations, it's up to the individual providers to go out and figure out what changes have occurred. They're not notified through a print method. They might be given, I think my providers received a postcard saying, hey, go check out this website and find out what's changed. But it didn't happen for everybody. And that's really conditional that everybody has like internet service, which doesn't necessarily happen either. So I just wanted to point that out and thank you for that.
Thank you, Representative Sandsted. Any other?
Can you make a comment back to that?
Ms. Cunningham.
Sorry, thanks. Yes. The whole complexities of how rules are, what I would suggest is in this past year, DHS has done a much greater standard or practice of informing us. We did receive a postcard that said to go to the website that had comprehensive and a detailed implementation of 2017 rules that was amazing as a person who's worked with this for years. The actual implementation that DHS put forth clearly stated everything, told us exactly what licensors were going to do, what they couldn't do. That was information we've never been able to have. Okay, so that part. To your point, though, if you had to have internet access to be able to get it, and we know there's places that don't or providers that don't, so that's part of the challenge with it. The rule book, to broaden on your comment maybe, the rule book itself is not printed until October. The rules are in place when you cease your work, which thank you very much for that. I heard it was late last night. So the work that you do is online. I access it. I almost can't read the rule book because it's very difficult to find things. So the point to all of that is it needs that addressing. DHS did go across the state and did do a lot of interactions and interchange with providers that we've never had before. I think those are all good steps in the right directions, and I'm counting on trusting that they're going to continue. Many providers don't either experience it, see it, feel it, got to the meetings, and getting over that sense that we don't have information and kind of like we're not going to get it it's going to take that 7 times of hearing things probably to get to the point where providers can trust and understand what we are getting is accurate and respectful and in process. I have been one that says we need to combine these things, we need to work with them. My request is that the legislators have an involvement, a process on that, but also that stakeholders too, knowing and understanding that DHS has the right to be able to do it. My relationship and sense with DHS at this point is there is an openness and communication and respectful process with it that I've not, I guess since the Safe Sleep, that's been a lot of the progress that's come forth, so.
Thank you, Ms. Cunningham. Is there anyone else who wishes to testify on House File 3403? Welcome to the committee. You could please state your name for the record and present your testimony.
Thank you. Mr. Chair, members of the committee, my name is Reggie Wagner, and I oversee the licensing division at the Department of Human Services. And very briefly, want to just comment that we have reviewed the amendment, and as Representative Peterson said, we are maybe giving a little bit of technical assistance on some of it, but in general, these do try to operationalize some of what we have been doing on either a smaller individualized basis or with providers. And sometimes putting that clarity in statute makes very clear that we have the ability to do this, and it allows providers to know that they can come and seek variances. The variances, particularly on staff qualifications for centers, is something that we do a lot of each year, but we think that making clear to everyone that you can ask. Sometimes people just don't know that they can ask for a variance, and so this helps, and we think that there's some ways to continue to move forward and show that our variances can and are working to help address the workforce issues. We are going to continue to give some feedback to Representative Peterson. We've been speaking with Ms. Cunningham, who was bringing forward the issues on the safe sleep. We do potentially have some additional language that we would like to consider because it's an important area. We think it can be as narrow as we think perhaps Ms. Cunningham and Representative Peterson want, related to just those very, very early months and issues in safe sleep. So we thank you very much for the conversations and for the movement forward on these issues. Thank you.
Thank you, Ms. Wagner. Are there questions for the department? Representative Liebling.
Thank you, Mr. Chair, and thank you, Ms. Wagner. I just, I've been around here a while now, and I've never had this as an area of focus, but I've kind of been witness to some of the changes that have happened, and just on the safe sleep issue, I recall that we had some years when we had some deaths in childcare. And that really horrified everyone, and I guess that the problem has abated. And I know that there's always this problem with regulation. You just got to strike the right balance. So you can try to solve a problem and then go too far. But I just wonder if you would take a moment to kind of remind us of the success on the improving safety in childcare. And I have to say, I have a now 1-year-old grandson, my first grandchild. And so I've, been kind of really close to this issue because he goes to daycare. And, my son and daughter-in-law are super cautious at home and so on the safe sleep thing. When my kids were young, there was nothing about safe sleep, right? And so I think we've made obviously a lot of advancement in educating parents. And, I just want to, you have kind of current numbers for us of where we've come from and where we are now, because I've always thought, absolutely we need childcare, and absolutely parents need a safe place to bring their kids to be able to work. But we also, when you drop your child off at childcare, you've got to have confidence that you're going to see your child at the end of the day. And it's one of the most horrifying things you can imagine, to think that something might happen to your child in childcare. So the fact that we've made some advancement on this front is really, really critical.
Ms. Wagner.
Mr. Chair, Representative Liebling and members, yes, Representative Liebling is referring to sort of a spike in deaths in licensed settings back around 2012 is when we certainly became very aware that that number was trending up, and averaging about those couple of years, there are 11 or 12 deaths, generally with infants, most of those all occurring in licensed family childcare at that time. There were significant efforts done both with public awareness. There was certainly some media attention. Legislative activity in the 2013 session also generated both good policy discussions as well as additional media attention. I would say certainly from my understanding, although I wasn't working on the issue at the time, my understanding is that the provider communities themselves became very involved. Clearly, they do that work on a day-to-day basis. They take that and took that very seriously as well as personally. It was a very challenging discussion to have. What parents choose to do at home in their own understanding of infant safe sleep can sometimes put a little bit of attention with what the state asks a licensed provider who is doing this as a business to do. And so we know, we've heard from providers that sometimes that interaction with parents can even be a challenge in terms of them being able to explain, this is what I have to do, this is what my limits are. There were legislative changes in 2013. Some of the language that you're looking at right now was definitely a result of that. And there were some additional training topics required as a result of that period in 2013. Since then, I am very pleased to be able to say that the number of deaths has dropped very significantly. And while one death is certainly very tragic, it has gone down to barely maybe 1 to 3. I think currently it's about 3. I can certainly get an updated information sheet about that. And with the safe sleep, the deaths of infants at that time in 2013, more than 70% of the infant deaths also had ultimately a safe sleep violation associated with it. And so that's why we talk about infant safe sleep, because that was an association. And while no one can ever talk about what causes a death, and some of those had nothing to do, they could have been a medically fragile child, an unknown medical diagnosis, there was that correlation on licensing violations when the investigation concluded, and so that led to some of the additional. So we understand that the attempt on some of this language coming forward is to perhaps continue to add that clarification as new products are coming on the market, as parents may be doing something, and a license holder being able to say, this is what's okay for me based upon the regs. So we think that we understand perhaps the need to bring some clarity into that statute, but given where we've come and the great progress and how much the providers have owned that as an important part for them, has been very encouraging.
Thank you.
Representative Liebling.
Thank you.
Representative Baker.
Thank you, Mr. Chair, and thank you, Representative Peterson, for bringing this really good information to the committee. And thank you, Representative Sandstead, for meeting with your group back in your district. It surprises me that we are charging them for regulations and rules when they're licensing. So to Ms. Wagner, if I could, what is the cost of that manual if they wanted to buy that? And also, is there a easy-to-read version that isn't just full of statutes and things that are difficult to sort of follow and understand for the providers? Is there a different version of that to kind of give it more of a easier-to-read version? And again, how much is the cost?
Ms. Wagner.
Mr. Chair, Representative Baker, members of the committee, I'm sorry, I don't know the exact cost of that book. It certainly is possible that either one of my staff or possibly I know Ms. Cunningham has talked with me several times about it, so she may. Thank you. 1995. Free shipping. No. 1995. Thank you. I apologize. We give those rule books. Those rule books are created across all of our licensed areas, not just within family child care. And I really do appreciate the comments that have come up related to that, with the requirement that was passed last session that the department provide information, and it did say it could be in an electronic format, but we do know that not everybody has that access, and sometimes, I mean, we all walk around with our books, and that paper is helpful. So we are definitely, as I know a few people have commented, looking at how we can continue to improve our communication. What we've heard from particularly Ms. Cunningham and others is that, you know, there's so much in our Chapter 245A, the Human Services Licensing Act, that isn't relevant to the family providers. There are things in there related to, some of our CD treatment programs. I mean, it's very comprehensive across all our service classes. So we're really trying to kind of figure out how can we bring forward a book that is more plain language, but doesn't perhaps stray into, is it a guidelines, is it interpretive, what does the statute say? So it's an area that I know we have to do better. I think, as one of the testifiers said, our implementation guide, particularly for family providers, we did one for centers this year. And for as much as we know there were some good things we did, we got some good feedback about ways we can change that. So I think we're on the right track for providing helpful compliance information in a way that the provider does find useful. And as we begin to continue our outreach with counties, both the licensing staff as well as the providers, I think we're going to get very concrete feedback on how our tools are moving in the right direction and where we can do a better job.
Representative Baker.
And just to follow up, Mr. Chair, again, what I've learned with the whole MNLARS mess is that listen to the stakeholders. Listen to what they want. And I think the people in the department really want to help, but you are too far down the foxhole. It's just, I think what I've seen is they need to have maybe a 3-ring binder. They can have tabs. They can flip to the tab on sleep, or if it's on certain regulations, or percentages of children and all those kind of things. So just listen to their needs and wants. We have got to change this as fast as we can with always safety in mind, and I know that's what everybody is wanting to have to get it right. But we've got to make this where it's easier and not overwhelming, and this is a huge part of this moment. So thank you for that, Ms. Wagner.
Representative Flanagan.
Thank you, Mr. Chair. And I just wanted to, and I mentioned this in our child care subcommittee as well, just thank Representative Peterson for removing the piece on ratios. I think we, to Ms. Wagner talking about the changes and the positive changes in the amount of accidents and deaths in centers, I think we have more conversations to have about ratios, and safety is clearly, for all of us, is most important. So I just want to thank you for making that change. But also to Ms. Wagner, I had a question regarding variances. Could you give a couple of examples of what people request variances for with regards to staffing?
Ms. Wagner.
Mr. Chair, Representative Flanagan, members, some of the issues could be that they don't have a certain, so under our rule, which is very outdated and a little bit prescriptive, you can meet, for instance, teacher or assistant teacher qualifications in a number of ways, and sometimes it's by having a certain number of hours completed for either coursework or classroom time or a combination. And so a variance could be requested until that period of time. They're generally time limited until somebody achieves whatever that threshold is. And so, again, they're a case-by-case basis. The provider needs to ask for it, but it is a way to say, I want to hire this person. They're only here. Here's my plan. Here's their plan that I'm working with them on. It might involve outside coursework to get there. So that would be a very, very common one.
Representative Flanagan.
Thank you. Do you ever get requests if, say, we know that a child will be sick for a week, and then the request is that that person then is not staffing or is not working for the week because the ratio has changed?
Ms. Wagner.
Mr. Chair, Representative Flanagan, I don't believe that we get those. Those children are generally for that short-term abscess just viewed as part of the ratio and the capacity. And so that kind of flexing isn't there. I do think that in the amendment that Representative Peterson has with regards to what's now, I'm not quite sure, but the one around the subdivision 4A, the new language for family child care in particular, that concept is pretty much what's captured in here for just part-time care. So that's a little bit different than an absence. That's more short-term, but it's a little bit for a parent that maybe only has a need for infant care for 2 days a week, and our current, cookie-cutter licensing approach for that individual provider may not allow it. So it's a little bit different than what you're talking about.
Mr. Chair?
Representative Peterson.
I do have an example. It was recently implemented in Olmsted County that accommodated a child care provider serving an infant from a family of a Mayo nurse, and who worked 2 12-hour shifts. So that's where some of those staffing flexibilities and ratios can come into, instead of like all week long, can maybe be reflecting those 2 12-hour shifts. Does that make sense?
Yeah, that makes sense.
Representative Flanagan.
Thank you.
Representative Albright.
Thank you, Mr. Chair. Ms. Wagner, I'm looking in the section of the laws and rules that pertain to licensure fees. I'm just wondering, and this is a bit rhetorical, but I'll get to the question in a second. But what does a licensed child care provider get for their license fee on an annual basis?
Ms. Wagner.
Mr. Chair, Representative Albright, members, what the fee does is it pays in part. The fee does not pay completely for the cost of the oversight, technical assistance, and regulation. There's a separate fee for the application. And then once you are licensed, our child care centers are licensed on what we sometimes talk to as a continuous basis, and so the fee is part of their renewal. We assist with either maltreatment. There is maltreatment for the child care centers that the DHS staff do, so that is a part of what the licensing fee, although they go to the general fund, that is a part of what the licensing fee involves. It involves any of the request for variances, as we talked about, individual technical assistance that a provider might call the department and have questions with, and then certainly the monitoring and visits and reviews. Some of those are scheduled on a regular basis, and then some of those are with regards to responding to complaints that reach a level where someone would need to be on site.
Representative Albright.
Thank you, Mr. Chair. Ms. Wagner, as I look at this book, and as you know, in my experience coming from the securities industry, I must tell you that this book probably contains more rules and regulations than the securities industry takes under consideration when they license a securities dealer. You have 3 pages just to the mediation requirements for if something happens in a swimming pool. And yet, you're expecting child care providers to pay an additional fee, this is a small point, rather than have this included and submitted back to them as part of receipt of their, what I would think, their licensing fee on an annual basis. You are expecting them to comply with the law, but you're not providing it to them. I think that's shameful.
Representative Liebling.
Thanks, Mr. Chair. I mean, just Ms. Wagner didn't write the law, and I don't think she's in charge of deciding whether people need to pay for the book. And, you know, sometimes Representative Albright, I don't know if it's, I agree it should be easy for people to find out what the rules are. We all agree with that, and I think Ms. Wagner probably agrees as much as anybody with that. But, you know, if there's a problem, if the rules aren't clear and so on, that's our job to fix it.
Any other questions for Ms. Wagner? Representative Dean.
Thanks, Mr. Chair, and this may be to Representative Peterson or Representative Franson, and just with the subcommittee's work on licensing and on stuff. Anecdotally, we hear from folks all over the state that we're losing childcare slots. And particularly in greater Minnesota employers, it's a huge deal that can't get employees can't find childcare. Daycares that used to be licensed aren't licensed anymore. Have we asked for, do we know by county, by size of provider, and by age group, infant, toddler, preschool, school age, small, medium, large, small county, large county, what those slots were and where they are, so we're actually looking at where we're losing slots. Because we all know, we hear anecdotally, I can't keep up with these rules anymore, it's just too much red tape, I can't deal with it, it's too expensive, I'm out. You know, the stay-at-home husband or wife or aunt with 4, 5, 6 kids just can't do it anymore, says no, centers closed down. Do we actually have an audit, or are we going to have a report back to this committee, to the Finance Committee, to Representative Garofalo's committee that really looks at what our capacity is and where the numbers are, in addition to just the headaches and the red tape that people say they're walking away from?
Ms. Wagner.
Mr. Chair, members of the committee, I wasn't certain if Representative Peterson or Representative Franson wanted to respond. I have some information that I can offer as well. And well, since sure, since I have the mic, thank you. We have provided, and I certainly can provide for members of this committee, county basis, broken out and change in number of licenses per county over any period of time, the last 5 years, the last 7 years. I will say that what we haven't done on a kind of more analyzed basis is some of the more deeper that you've talked to in terms of the changes in license capacity by either the overall size. So we've done more of the net and not looking at infants versus toddlers, things that would need to be called out and captured. Some data points aren't always captured, but some of them are. So we have some trend information. We can certainly make that available. And I think that's an important point to talk about, not just where the license slots are, but what kind of slots, and are they for infants, are they for toddlers, where have the changes been? And we definitely agree that a regional approach, understanding how those trends are playing out, particularly as different economic indicators change across the state, is an important thing, and we've been trying to do a little bit more of that within the licensing division.
Chair Dean. Representative Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, I just have I would voice some similar concerns. You're just, the circumstantial evidence of daycare providers that I've talked to is they're just being regulated right out of existence, okay? So, I share those similar concerns. In fact, I got one small community in my district that had a citywide meeting to try to address the crisis of daycare access for parents. So does the department, Ms. Wagner, conduct exit interviews of daycare providers who have decided to leave the business and no longer provide that service?
Ms. Wagner.
Mr. Chair, Representative Gruenhagen, no, the department does not regularly do that. And in our work with the counties, where the county licensors are the ones that are opening and closing the, doing that transactional part with approval from the department, they do not consistently do that. I do think, whether it's for this time or now, there is a testifier that I know Think Small has done a recent study on that with family child care, and they may be able to provide some information today or in the future. I do wish to say, and I appreciate clearly between this committee and the subcommittee in previous sessions, the concerns about the role of regulation. We have been hearing that, and I think there's been a little bit of testimony today and acknowledgement that we're trying to engage more with providers to get more information. We clearly have a long way to go and a lot of ground to make up, and I know that. I do want to say, though, for members that the issue of the decline in family child cares is very complicated. It is a national trend, particularly within family child cares, and so there's not sort of one unique thing happening in Minnesota. It's a problem. I'm trying to do more with other colleagues in other states to understand what some of their solutions have been, but we also know that it's very complicated in terms of it can be tied with the economic, and when the economy is going up, when it is going down. In some areas, it may be more of a marginal income basis, and there may be other alternatives. So regulation does play a role. We hear people say that. It's both reality and perception, and our job is to really figure out how much the realities are. And I think Representative Peterson's final section regarding updating the rules, that has come across very clear in our conversations this past year, particularly with family child care providers, but even centers. The folks are making it clear that these rules are very outdated. And when we have to use our variance authority, when we have to do these one-offs for things that are really system issues, we need to do a better job of capturing that, bringing it forward with stakeholder input, and modernizing our rules, and not just having everything being done patchwork.
Representative Gruenhagen.
Thank you, Mr. Wagner. I just want to add my voice to we all want a safe environment for the children. but I do think it can be overdone, you know, in terms of micromanaging what happens at these daycare centers to a certain degree. At least that's been my feedback circumstantially from the daycare providers I've talked to who have left the business and no longer offer this service. Thank you.
Representative Franson.
Thank you, Mr. Chair. I have requested some of the information that Representative Dean is talking about and would like to see as well. That was requested on February 23rd. We have yet to get that information, Representative Dean. And then also there's supposed to be a report to the status of childcare, which we haven't seen yet either. So.
Thank you, Representative Franson. Representative Flanagan.
Thank you, Mr. Chair. So I think to Ms. Wagner's point, you know, we have had lots of conversations about rules and regulations, and I think we've made some progress there as well. But I do want to lift up, I don't want us to leave this hearing without talking about the additional things that we're hearing from providers and communities. And one of those things that legislators can do is increase the reimbursement rates for providers. And I think we have heard that loud and clear over the last several years as we have been traveling across the state. I appreciate the commitment of so many people on this committee and the leadership of Representative Franson and others. And I think that we've talked about this problem a lot, and I think we've heard really clear answers about what we need to do, which is to increase those provider reimbursement rates. We also have to look at the full funding and forecasting of the Child Care Assistance Program, which is something that we've had bipartisan support for over the years. And then finally, look at models like co-ops that work in Greater Minnesota, invest and train folks across the state in these areas that we've identified as child care deserts. Work in partnership with businesses to provide incentives to open care either on site or with a local community partner. So I think I appreciate the subcommittee and I appreciate the focus that we've had on this in the legislature, and I think it's time for us to act, and we know how to fix this problem.
Thank you, Ms. Wagner, for your testimony today. Is there anyone else who wishes to testify in House File 3403? Welcome to the committee. Please state your name for the record and present your testimony.
Thank you. My name is Elizabeth Bangert. I am the owner and director of Here We Grow Early Childhood Center in Mankato, and I also serve as a consultant for a number of small communities who are trying to solve the child care crisis. I would like to speak directly to the portion regarding the child care licensing reform. And if I may, I know that everyone is very busy, but I would like to draw attention to something called the JOY Initiative. The JOY Initiative is an over 3,000-page report that includes data that demonstrates some of the red tape. It is available on the subcommittee website. There are 41 plunger violations. A violation for having a plunger in a restroom that qualifies under health and safety. So we need to seriously look at the interpretive manner in which these regulations are being enforced. Additionally, regarding the report to the legislature, which is according to statute 245A.153, which I have read because I had to find it, there it calls in subpart 1 a summary of data on trends, which another representative asked for. It calls for a description of any changes to statute. And under subpart 3, item I, it encourages uniformity in implementing and interpreting statutes. Of the 300 out of 1,809 licensed child care centers that we reviewed, there is not uniformity. We actually, my colleague and I, color-coded different citations to demonstrate the lack of uniformity, especially relating to conditional licenses, which is a huge negative action against a center. There needs to be some type of consistency with the number and interpretation that pertains to a conditional license. In addition, I would really like you to call attention to what the legislature stated in the report, or not the legislature, sorry, DHS, relating to Section 3, Subpart 4, implementing confidential, anonymous communication processes for child care providers to ask questions and receive prompt, clear answers from the department. They actually are not implementing that, and they state why they are not implementing that, and I think that speaks to the degree of transparency or the lack of transparency that there is right now. And I would like and ask you to pay special attention to the specific wording that is used. Wording that, in my opinion, states that they need to track which licensor said what. If you are interpreting guidelines consistently, why is there a need to track who said what, you should know what the answer is consistently at all times. And furthermore, no one is going to ask a question because of fear of retaliation. The reason that people are having a hard time speaking out is because currently an administrative law judge does not have the final say in a child care setting. So therefore, you go see an ALJ and they make a ruling, and then DHS can still turn it over. Who would want to go up against that? Apparently me, and I will not go into detail why, but I urge you to watch the testimony of the providers, because there will be a day when people wake up and there will not be providers, and it is coming soon.
Thank you, Ms. Bangert, for your testimony. Representative Franson.
Thank you, Mr. Chair, and thank you for coming in front of the committee again, Ms. Bangert. So one of the hearings that we had, I just cannot get this image out of my head where you Ms. Bangert and one of her other testifiers was up there to testify on the conditions, and the paper is shaking in their hands because they are so terrified of speaking in public for fear of retaliation. Yes, only it was 10 times worse. You've gotten a little better. Yeah. I can't get that image out of my head because these are predominantly women that own these businesses coming in front of the legislature, a branch of government, to talk about the agencies within our government and how they are treating these women. That's terrifying. They should be able to come in front of us and not fear retaliation from their government. They should not fear their government. They should not fear the agencies, but yet that is what is happening. And I have emails from providers that have come forward to tell me that they can't no longer testify because now they've got a bullseye on their back, and now they've got extra licensors coming into their business to create more hassle for them, creating more anxiety and more stress. All they want to do is keep their businesses going. They love the children that they're caring for. They want to keep their community vibrant and providing a service so that people can go to work and employers have employees to do that work, and so that Minnesota can be a vibrant, thriving state. So my question to you, Ms. Bangert, is your group has been extremely vocal in the harassment that DHS and the licensors have created within the businesses. So my question to you is, has your group sensed any retaliation or been visited unexpectedly since you've been speaking out against the behavior that you had been experiencing?
Bangert.
Representative Franson, Chair. Actually, yes, I went on vacation last week, and I told parents that I was in meetings all week, and I also purchased 2 GoPro cameras to follow around licensors if they appeared. Additionally, there is an individual in the audience today who received a licensing review, and 2 licensors appeared with cameras to take pictures this time. They have never used cameras before, to my knowledge. I have not spoken to a single person who has heard of the use of a camera. I find it quite disgusting that I feel inclined to find an attorney and wear GoPros around my center when all I would like to do is work with children.
Representative Franson.
That's it.
Representative Keel.
Thank you, Mr. Chair and members. Thank you very much for your testimony. In my district, I discovered that this is happening, but not by way of the child care provider, by way of the parents who were very frustrated. They all love their daycare and called me and said, please do something. Well, we're waiting for the department to hand down or render their verdict on what the county has already said is just fine. And the suggestion was made to the provider. I found out that she hired an attorney. And when I inquired, she said, well, I have loans to set this daycare up. I can't possibly afford to add to this to fight a decision that's I've already been told is fine. My children are fine. The parents say I'm fine. I don't understand. I'm just very surprised by all this. And I found out that she was in fear of calling me because she didn't know what the consequences would be. So this is really happening, and it's in a place where 2 people had to quit their jobs because they did not have any other way to take care of their children. So, and we need people, we need employees up in our neck of the woods. So that was not good for the business either. Anyway, thank you.
Thank you, Representative Keel. Thank you, Ms. Bangert, for your testimony today. Any questions from members for the bill author? Seeing none, final word, Representative Peterson.
Thank you, Mr. Chair and members. We've come a long way since 2012, and I think that this is a step in the right way. And it's going to start out by being a collaborative process. And first, I want to thank Chair Franson, Representative Flanagan, as well as all the stakeholders that were part of this process, whether it was the Department of Human Services, the counties, and the providers. And together, I agree, we will make this better, and we will have a better system for our children and families. Thank you, Mr. Speaker, or Mr. Speaker, Mr. Chair. And ask for your vote.
Representative Peterson now renews her motion that House File 3403 as amended be re-referred to the General Register. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 3403 as amended is referred to the General Register. Thank you, Representative Peterson. With that, we will stand in recess until the call of the chair of approximately 6:30.